Hello. The disease that I chose to present over today is rheumatoid arthritis. The main reason why I chose rheumatoid arthritis to do this presentation over was because my aunt has this condition. Rheumatoid arthritis is a genetic disease. Knowing that it is genetic, it's a disease that could possibly affect me later on in life. So this would just be a good information to know just in case I do develop the disease later on in life. I'm most excited to learn more about this disease in general. Like I said earlier, it is a genetic disease, meaning that it could possibly affect me since it does run in my family. And it would be good information to know what's going on with my body. And then I could also possibly catch early symptoms and hopefully slow down the disease if I catch it early enough. The definition of rheumatoid arthritis is a immune disease characterized by symmetrical inflammation of joints of the hands, feet, and knees. The severity does differ from person to person and then can fluctuate over time, so it doesn't always stay the same. There is 1 to 2% of the United States population that's affected by rheumatoid arthritis. The onset of RA occurs between the ages of 35 and 50. It is more prevalent in women than in men. 70% of the people living with RA are women, and 55% are over the age of 55. The cause of RA is unknown, but evidence has shown that there is a interrelationship of infectious agents, genetics, and autoimmunity. Viral agents alter the immune system in a genetically predisposed person, leading to the destruction of synovial tissues. It does occur in families, which suggests the genetic component, but the gene has not been identified yet. People that have RA have a tissue marker called HLA-DR4, but not everyone that develops RA has this tissue marker. RA involves an interaction between immune cells and cells that are in the joints that are responsible for normal tissue maintenance. RA does not only affect just the joints of the hands and feet, but it can also affect the skin, the eyes, lungs, and blood. Sleep disorders are a complication that most patients with rheumatoid arthritis have. The signs and symptoms. The most common sign of rheumatoid arthritis is swelling and pain in the joints of the hands and the feet. The healthcare provider would see joints on an X-ray, ultrasound, or an MRI with bone that looks like it's breaking down, kind of like in the picture right below. Tenderness in the joints, having difficulty moving, and then mouth and eye dryness is also a symptom. The symptoms of the disease are more of a broad and difficult disease to determine. The clinical manifestations, there's TMJ involvement. Um, the TMJ joint just gets tender and swells and gets stiff. And then also the fibrosis or bony ankylose. For the diagnosis, the doctor will ask the patient about their medical history and symptoms that they are having, such as pain, tenderness, or stiffness. When the symptoms first started, how bad the pain, tenderness, or stiffness is, and if the patient has any family members who also have rheumatoid arthritis. The doctor will take a physical look at the patient. They will look to see if the patient has any swelling, tenderness in the joints, warmth, and painful movements. Blood tests are another test that can be determined if a patient has rheumatoid arthritis. Erythrocyte sedimentation rate and C-active protein levels have markers for inflammation. When both of these are combined, this can help make a diagnosis for rheumatoid arthritis. Imaging testing is the last type of test that can determine a diagnosis for rheumatoid arthritis. RA may cause the bone within the joint to wear down. An X-ray, ultrasound, or MRI can look at the parts of the bones that are worn down. The way rheumatoid arthritis is diagnosed is by a rheumatologist. They will look at the patient's medical history, physical exams, and also the lab tests. Right. And for medical management, rheumatoid arthritis does not have a known cure for it. The main treatment is to control inflammation of the joints, relieve the pain, and maintain functions of the joints that are affected. NSAIDs, corticosteroids, and disease-modifying anti-rheumatic drugs are used to reduce pain and inflammation. Reduction of joint stress, physical or occupational therapy, and then joint surgery is also an option for patients that have severe inflammation. Like I said earlier, there's TMJ involvement. They're just not able to open their jaw quite as much if it's affected just because it's super sore. Xerostomia, and then also difficulty with oral hygiene just because they can't use their toothbrush too well if it's like in their shoulders or in their hands. NSAIDs usually cause ulcers. Corticosteroids cause oral candidiasis and delay wound healing. And then DMARDs increase risk of infection. Why does the dental team need to be aware of this condition? They need to be aware because the medication can cause increased infection or bleeding, and then they would want to keep the patient as comfortable as possible. This condition is managed from a dental perspective by reviewing medical history, keeping the appointment short. Some precautions that need to be taken in the dental chair is if a patient had a joint replacement, they may need a pre-med before appointments. And they may need to use a pillow to keep the patient more comfortable in the chair. The type of modifications to treatment that might be needed. If the appointments are longer appointments, allow the patient to have some small breaks in between. If the TMJ limits the amount the patient can open, use a bite block. Usually whenever the patient is in an active state of rheumatoid arthritis, they can receive dental treatment, but needs to be focused around patient comfort. And then whenever it's inactive, patients should be able to have any kind of treatment. All right. The biggest takeaway from researching rheumatoid arthritis is that it's giving me an understanding that people with RA require careful management to allow the most comfortability. The most interesting thing that I learned about researching about rheumatoid arthritis is there are a ton of different ways to help manage the disease, but there is no cure to it. I hope that one day they will come up with a cure to help the individuals that have this disease to be more comfortable. I will apply the knowledge that I've learned in the care as a dental hygienist by adapting the care to make the patient more comfortable. I did enjoy learning about rheumatoid arthritis because it includes the medical and dental field together. I have seen firsthand the challenges that someone has with rheumatoid arthritis. Being able to learn how it is affected in the dental field will allow me to help my patients in the future. And then that is just my references.